As the demand for personalized care continues to grow, healthcare providers are leveraging strategic integrations to get a 360-degree view of their patients. And that's where our partnership with Athenahealth comes in. I'm Kerry Chow, joined by Michael Palantoni, Chief Strategy and Corporate Development Officer at Athenahealth. Michael, thank you so much for joining us. Really quickly, what does Athenahealth do, and why was a partnership with Salesforce so important?
So Athenahealth is the nation's largest cloud-based EHR practice management and rev cycle system. That's the core operating system for practices. It's how doctors take care of patients, how they get paid, how they coordinate care. And so what we're trying to do is create an open ecosystem of our clients to bring in tools and services and partners like Salesforce into that broader practice toolkit for them to use.
I like that. From Athenahealth's perspective, though, what are the most significant pain points, if you will, for healthcare providers that this partnership will address, but especially concerning administrative burden and patient experience?
Yeah, so in the context of Athena and Salesforce, the challenge for a long time has been, how do you create great consumer and service experiences in healthcare? One of the challenges is that healthcare is very local, specific to the practice and the provider in question. Yet for bigger organizations, regional organizations, national organizations, they're trying to build national brands, national service and experience. And so the challenge is, how do you integrate that national brand and service experience, the efficiency of it, the service centers behind it, into that local practice and provider relationship? So that's what we're really trying to solve with this partnership.
Yeah, so I want to be a little more specific here. What are the key benefits that healthcare providers can expect to realize from this? Like, give me some use case examples.
Yeah, so the use case here is, let's talk about appointment scheduling. So let's say I'm a patient, I'm out trying to get a follow-up for my primary care provider or be seen at an urgent care center, and I'm interacting and searching on a national brand that is being backed by a Salesforce customer service center experience. But I'm trying to get access and care to my healthcare delivery center down the street, or my PCP that I know. What this allows us to do with this integration is for me to call into that service center through real-time API integration, be scheduled directly into that local practice, whether it be referencing that practice's rules, information about my care record, my health status, my needs. I can now have that real-time service experience at that national brand level directly integrated to that local practice.
It's incredible. How do you envision then the partnership enhancing interoperability within the broader healthcare ecosystem, as well as driving future standards for data integration?
Yeah, I think when you think about interoperability in this space, there's a lot of exciting things happening in the clinical space of clinical data exchange. One of the areas interoperability is lagging, I would argue, is the patient and consumer-driven service space. So we think about things like scheduling, access, information around communication with the practice. This creates a new type of interoperability that is not just the clinical data for the providers, but puts the patient in the middle of that, of how they're communicating with their practice.
It's all about the patient, right? So agentic AI, it's a driving force in personalizing and enhancing that patient experience that we just talked about. What role, and you touched on this, but what role does real-time patient data exchange play in this next generation of patient care?
Sure, so you think about what's happening with agents and their ability to serve at scale, 24/7, around the clock, infinite scale. But to actually deliver an outcome in healthcare, you need to connect that locally. And so what this allows us to do is to put that layer on top of the practice, have it interact in real time with what's going on at the practice, and not just be a handoff experience even if you've already triaged it. So now you can go from contact, agent, all the way to practice in one synchronous workflow.
And that's all with Agentforce for Health.
100%. So being able to use the Agentforce toolkit and expand upon it directly on the practice through the power of our API and the Athenahealth platform, 100%.
Looking ahead, and if you've outlined a lot of visionary here, what kind of long-term impact do you envision this partnership having on just how healthcare is delivered?
Yeah, I think one of the holy grails in healthcare has been consumer-grade experience. And one of the issues, again, going back to this healthcare as local, it's tough to manage an intimate relationship with consumer-grade experience. And so when you think about this partnership it enables to blend those two worlds together. A great consumer, customer, and service platform like Salesforce with the nation's leading cloud-based clinic platform being Athena allows a whole new category of consumer experience to be live, to be actionable, and to be differentiated for those organizations. One practice's experience isn't going to be the same as another's. And so this allows the flexibility of that integration to be spread across multiple different types of experiences and health systems. So really excited about its future.
Essentially, the big winner here is patience.
100%, 100%.
I love it. Thank you so much for your insights, and thank you for joining us here, Michael. To learn more about how Salesforce can help your health and life sciences organization, scan the QR code on your screen or visit salesforce.com/HLS.